Hello everyone, I am Dr. Ghanee. Thank you for watching this video. Today I'm going to show you a condition, a lesion that can happen on hard and soft palate. You can see this patient has multiple bumps on kind of junction of hard and soft palate. Actually, there are one here, 2, 3, and maybe smaller ones there. What is our differential diagnosis? What is the possibility and how we manage this lesion? First of all, they can have multiple fibromas on their palate. And I have a previous video that I showed you some examples. Fibromas are benign. Another possibility is adenomatoid hyperplasia, which I'm going to explain to you about this condition in this video. We have minor salivary glands in our mouth. They are everywhere, scattered in our mouth. Especially on palate, hard and soft palate, we have a lot of minor salivary glands under the surface mucosa, and they make saliva. Sometimes these salivary glands, they grow as a tumor. A tumor can arise from these minor salivary glands. If the tumor is benign, we call it an adenoma. And if it is malignant, it is under adenocarcinoma and so many other types of adenocarcinoma. But sometimes those salivary glands, they grow and make more and more cells. They show proliferation, but they don't make a tumor, an adenoma or adenocarcinoma. That's why their growth is adenomatoid. It means it's similar to adenoma, but it's just proliferation and making more and more cells that they all come from those minor salivary gland. And then hyperplasia, I explained it to you in my previous videos. It means when we have proliferation of cells, the tissue is enlarging, but it's not going to make a tumor, a benign or malignant tumor. So when I see a patient with this condition, usually differential diagnosis is going to be either multiple fibromas or adenomatoid hyperplasia. And I talk to the patient and I tell the patient that we can monitor these. But sometimes patients are worried and they request an incisional biopsy. For example, I remove 1 or 2 of them and I put it under the microscope. And I did for this patient. This is a closer view. You can see those bumps. And this is the result after the biopsy went under the microscope. Adenomatoid hyperplasia. Usually in textbooks, they describe this as one lesion, not multiple. But over the years, I have been looking at these lesions every time I have had multiple lesions and patient wanted a biopsy, was concerned about it, and I did biopsy and the result was adenomatoid hyperplasia. I always saw it as multiple small lesions. Thank you so much for paying attention and being with me. Have a good day.